Hello, and thank you for joining today's webinar. We will be getting started in just a few minutes. Thank you for joining today's webinar. We'll be getting started in just a few minutes. Feel free to bring greetings and tell us where you're from in the chat. Hello, and thank you for joining today's webinar. We are ready to begin. Today's webinar is eligible for 1 contact hour. Sigma Theta Tau International Honor Society of Nursing is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Center's Commission on Accreditation. The planning committee members and speaker have disclosed no relevant financial relationships. To receive contact hours for this NCPD session, participants are required to attend the webinar and log into our learning management system to complete an evaluation form. Information on how to access this will be emailed to all attendees 1 week after the webinar. This webinar is being recorded and will be available via the Sigma repository within a few business days of recording. Following the presentation, if we have time, we will have a question and answer session. You'll see on your Zoom webinar control panel that you can send a message through the Q&A feature. This is where you can type in any questions you'd like to pose to the presenter. Be sure to hit send so that the message makes it to us. Please use the Q&A for questions and the chat feature to interact with other participants. We would like to thank our speaker for sharing their expertise with us today. Our speaker today is Linda Anders. Linda Anders is a board-certified nurse in nursing professional development and is currently employed with Sigma as the Nursing Education Programming Manager. Linda has been recognized as a leader among her peers as she has received 40 Under 40 Emerging Nurse Leader Award in Illinois and 100 Great Nurses Award in the state of Iowa. Linda is active in her local community through volunteering and nonprofit organization board involvement and is currently enrolled at University of Missouri Sinclair School of Nursing, where she is pursuing her Doctor of Nursing Practice degree with a graduate certificate in global public health. Welcome, and we will turn it over to Linda Anders.
Hello, everyone. Thank you so much for joining us today. I want to first give a shout out to my Sigma staff team that is supporting me on this webinar today. We couldn't do it without them, so mad props to the Sigma staff team. I want to greet everyone. I see in the chat that there are a lot of people from a variety of different locations, both in the United States and around the globe. So good morning, good afternoon, and good evening to all of you. Please continue to use the chat to interact with each other, to engage throughout the presentation. And then, like Megan said, please use the Q&A feature if you have any questions that we'll answer at the end. I want to thank you for joining us today. This topic is near and dear to my heart, and this is actually part of my DMP Student Quality Improvement Project with the University of Missouri in the Sinclair School of Nursing. I am slotted to graduate sometime this year, so that's very exciting. So I thank you for going along this journey with me. We're going to cover a couple basic topics today. This concept of food insecurity is really like almost boiling the ocean. It expands regions. It does not specifically have impact on any certain types of individuals. So it's really hard to narrow it down. So we are going to cover some basic foundational information, such as our basic terminology and things of that nature, but then we're going to talk about implications. What does it look like for our patients? What does living in a food desert look like? We're going to talk about the nurse's role in this, and then of course any concerns or barriers that you might experience as a nurse when you're assessing patients for food insecurity. And on the screen, you can see our learning objectives, what we're hoping that you will get from this. We want you to be able to identify what food insecurity is and how it impacts healthcare, how it impacts an individual's health, and then of course, what you can do to mitigate it. So we're going to launch a poll. This is a very basic poll, just kind of trying to get a touch base on what the group is feeling. Did you learn about food insecurity as it relates to patients when you were in nursing school or transitioning into practice? So we'll give you a minute to answer that. We have about 100 people on the webinar today, which is great. So just give everybody a few minutes to answer that poll that should have popped up. Lydia, thank you. You did your DMP dissertation back in 2018. Tips are welcome. All right, so let's go ahead and end that poll and share the results. We can see that 45 of you said that you did not learn about food insecurity, and 24 of you said not really, and just 8 of you said yes. So this is not surprising. If we look at all of the data and the research that is out there in the world today, you're going to see that there's not a lot of specific educational components for food insecurity. So we can go ahead and close that poll. Thank you so much. When I was doing my lit review research for this project, what I identified was whether it's academia or clinical. Academia doesn't usually specifically focus on food insecurity in the curriculum. It's not a basis of what we typically cover. We might cover the social determinants of health or the sustainable development goals, but not specifically going into each component of those. And then clinically, when we're onboarding nurses, we do not include that in the detailed onboarding process, orientation, clinical ladders. So if you're in a nurse residency program, there's not a lot of chatter about, okay, what if our patient doesn't have access to food? Or what if our patient doesn't have healthy food to get them day to day, and yet we're asking a lot of them to maintain a healthy lifestyle. So overall, there is this huge knowledge gap about nurses and what their role is in this specific space and place when it comes to, you could, in the social determinants of health or sustainable development goals. And we know that many interventions for addressing food insecurity do not lie specifically within the nursing profession, right? So rather various local resources or national programs. So we can say, oh, you can go to the food bank, but are we really helping them? So this slide talks about what is food insecurity. So according to the United Nations, individuals who lack regular access to enough safe and nutritious food for normal growth and development and an active and healthy lifestyle. So it's not just, having access to safe and nutritious food for growth and development, but also so you can maintain that active and healthy life. And there's really two components that can stem off of this. So one of them is the unavailability of food. We're going to talk about food deserts a little bit later, but if you don't have access to fresh, safe, nutritious food, then obviously you're not going to be consuming them. And then lack of resources to obtain the food. So if you do live in a food desert and the closest grocery store is 5 miles away and you don't have a vehicle to get there, the likelihood of you being able to obtain that food is very low. So a little bit of background and significance of the problem. I think we could talk all day about the social determinants of health and the sustainable development goals, but food insecurity really, or we could maybe shorten it to say FI, has been identified as potentially the most impactful social determinant of health. And we'll dive deeper into these in just a minute. The United Nations Sustainable Development Goal number 2 is to end hunger, achieve food security, and improve nutrition and promote sustainable agriculture. All of this ties together. And actually, we are currently in the biggest global food crisis since World War II. And that data was from the United Nations in 2022. So I think if we take a step back and just look at it, it's not just an American issue. And so food insecurity really is a global issue that's recognized under the social determinants of health related to the pillar of economic stability. And it's also addressed in this Sustainable Development Goal number 2 to end hunger by the United Nations. Depending on where you get your stats and your data, really vary on what the numbers look like, but 2.37 billion people are without food or are unable to eat a healthy, balanced diet worldwide, according to the United Nations in 2020. So that stat is actually pretty old if you think about how numbers are changing and the world's changing rapidly, and there's a lot going on in our world today. So I bet those numbers are actually increased due to our current global situations. I would say that food insecurity is a global issue affecting nurses worldwide. And the United Nations said between 2014 and the onset of the COVID pandemic, the number of people going hungry and suffering from food insecurity has gradually been rising. And now with the war in Ukraine disrupting the global food supply chain and the COVID-19 pandemic, all of that definitely, all forms of malnutrition have been exacerbated with those various components going on in the world. So when we look at overall the social determinants of health, you can see here that we have identified that food insecurity falls under economic stability. And then we also have the Sustainable Development Goal number 2 for zero hunger. Both of these are open access, copyright free, so you are welcome to go to Healthy People 2030, or also the United Nations website, and you can extract information, graphics, and things of that nature if this is something you want to explore for the future. I would say if we look at and focus on economic stability first, it affects many patients that we as nurses interact with on a daily basis who they can't afford food, healthcare, or housing. And that directly relates to food insecurity or food security, right? And then the sustainable health goal is a global blueprint. And I know these have kind of been buzzwords in the last few years, but if you really don't know the meat and bones of what they're about, it's just one more thing. But when we actually look at how important this content is and how we are moving the needle, both locally in the United States with the social determinants of health and globally with the sustainable development goals, we really do make big strides. So the Sustainable Development Goals, are SDGs. There's 17 total, and like we talked about, number 2 focuses on food. And I want to make sure that I am clear and that you hear me when I say I acknowledge that food insecurity looks differently depending on where you're at in the globe. So food insecurity, let's say here in Illinois, Iowa, where I live, looks different than even food insecurity maybe in LA, but that also looks different than what it could be in the Philippines or India or et cetera, et cetera. So I want to make sure that you don't think that I'm ignoring the vast differences that we have here. And then, of course, like we talked about, the COVID-19 pandemic, we know it affected every aspect of our lives, every aspect of healthcare, but it increased the number of individuals living in poverty, and then, of course, thus increased their risk for food insecurity. And in my lit review for this work, it revealed that there was a positive correlation of food insecurity related to the pandemic. We're going to cover global stats, then we're going to talk about North American stats, and then we're going to talk about the United States. And after that, we're going to focus majority of the content today on US-centric type topics and content, but I want to make sure that I reiterate that these concepts can be applied no matter where you are. So when we look at global stats, it's astounding. If you think about, some days we get in our little worlds and, we forget to eat and we get hungry and we get angry, and it impacts everything that we do and everyone we interact with. So I want to make sure that we're very clear when we look at these numbers that these are people just like me and you around the world that don't have food on a daily basis. And this graph is a great pictorial diagram of how the numbers are slowly climbing over the last 6 years and now affects more than 30% of the world population. You can see on the left-hand side of the graph that this is world numbers. And then we have Africa, Asia, Latin America, and the Caribbean, and then the Northern American and Europe. Regardless of where they're at, they're all trending up, right? Which means that there are more people that don't have food on a daily basis. And then when we look at our children, one of our most vulnerable populations, they suffer the ramifications of not having nutritious, dense food on a daily basis. And one of those things that we see a positive correlation with is the fact that children that don't have adequate food obviously suffer from growth stunting and a variety of other things. But this number is pretty astounding. Approximately 149 million children under the age of 5 are suffering from growth stunting related to lack of nutritious food. So when we take it down to North America numbers, so we have 114 million people that are sitting in the moderate or severe food insecurity category. And then the United States, we have 33.8 million people that are living in food insecure houses. And we'll talk about the level of severity here in just the next slide. But when we look at a diagram of the United States, this is really telling. So we can see that where I currently live, Illinois, Iowa, I live in Illinois right over here, we can see that the Illinois sits in about the average of the United States numbers for food insecurity. About 10.4% of the population are food insecure. We can also see on the graph in these darker orange colors that some of our southern states are above the American average: South Carolina, Kentucky, West Virginia. So this, sometimes we can see all of the stats and we can see all the numbers, but sometimes we just need to see a visual to really let it sink in to where we're at in the severity of the situation. So in the United States, according to the Department of Agriculture, we have 9 states that are above the average for food insecurity. So what does this mean to our patients? Well, obviously there's overall health concerns and consequences. So when we look at, and I apologize, this is a little hard to read, but this is the food insecurity scale. And really, people experiencing moderate insecurity have reduced quality of food and or the quantity of food, and it's uncertain about their ability to obtain food. So we're talking about groups right in this area. And this could be due to lack of money or lack of other resources, like we talked about at the beginning, where if they don't have a vehicle and they live in a food desert, that would be a lack of resource to obtain the food. So this, of course, can increase the risk of some forms of malnutrition. And this goes back to the stunting of children, micronutrient deficiencies, and obesity in adults. And then we have people that experience severe food insecurity. So this is on the far end where there's no food for a day or more, that they've run out of food, and at most extremes have gone days without eating. This group of people are those that we call really the quote unquote hungry. So they're really struggling. On a personal note, I would be remiss not to talk about some of my personal life stories and how I came to be where I'm at today and why I'm so passionate about this topic. So many moons ago, when I was in elementary school, my family did not have a lot of money, if any. And so some days I would go to school without breakfast, and then I wouldn't have lunch because we couldn't afford. This was before a lot of free lunches and, free breakfasts and things like that that were provided by schools. And I will forever be grateful for the school nurse at this elementary school. I presented a lot of times to the nurse with abdominal pain, whether it was because I was hungry or I localized my anxiety and my trauma, for lack of better words, in my gut. And a lot of times she would let me sit in the office during lunch hours because I wouldn't be able to. I would sit in the cafeteria but wouldn't have any food, and all of my other everybody was eating except me. And she always had some crackers and some peanut butter for me to help me get through the rest of the day. And I share that story not for sympathy or for any sort of reaction, but rather to share that, like, I can feel this and I understand that sometimes you just don't have the resources or the ability to purchase nutritious food. In addition to that, I would say when we did have money, we were not purchasing or getting nutrient dense food, right? So when you are strapped for cash and you have other competing priorities, you're going to purchase cheaper items. So we know higher salt content, things you're purchasing at a convenience store, things in the center of the grocery store, not on the perimeter of the grocery store. So there's a lot of stuff there to unpack, but that's a personal story. And so if you think about all of these millions and billions of people that don't have access to food, I think it's going to help reframe the way we interact with patients and the way that we help them along their journey to get healthy, whatever healthy looks like for them. So when we talk about our patients and what the implications of health really are, we can see that food insecurity is a strong predictor of many chronic conditions. So lack of access to affordable, healthy food leads to negative health consequences, such as high rates of obesity. And that goes back to the calorie dense, nutrient less dense content that you're consuming, increased likelihood for diabetes and other conditions such as high blood pressure and cardiovascular disease. And that's from an article in 2020. We also have things like hepatitis that we need to be mindful of. And our poor liver just trying to, get all those toxins out can really take a hit. I would say when we look at FI or food insecurity and chronic conditions, this condition is really cyclical. So it just goes in this vicious cycle. So changes in health status and stress from food insecurity can result in development and progression of chronic diseases, causing further competing demands that exacerbate the food insecurity that the individual is experiencing. So it just keeps going. So we as nurses need to be able to have the tools to help them break this cycle. And I really do think we are a powerful profession and we can move the needle. And really, it's just figuring out how we can do that. So we're going to talk about a few of those in a bit. Food deserts. This is actually where my DMP project started. I was doing some research, trying to figure out where I fit. A lot of DMP students, when they enter, they have this great idea that they want to improve heart failure readmission rates, or they want to improve compliance of a fall bundle. Well, my mindset is different than that. And I had a more global and a more public health type of mindset. So I really struggled to identify what was I going to focus on. And I started thinking about food deserts and I wanted to see what my area looked like and what I could do to move the needle in my space and place. And so this is a map of my area. So this is called the Quad City Metropolitan Area. The Quad Cities is a population about 400,000. So you can see there's several cities here along the Mississippi River. And so if we think about this area that's surrounded by the interstates, that's basically the Quad Cities. So two main cities on the Iowa side and two main cities on the Illinois side. And of course, there's lots of other little cities around. So once again, a population of about 400,000. So when we apply a color graph, this color graph shows at least 500 people, or 33% of the population, live further than 1 mile from the nearest supermarket. And if it's rural, so if we're looking up in the upper left-hand corner in the rural type of area, it's greater than 10 miles. So you can see that there's a lot of pink, purple, whatever you want to call it, with this. So we're saying that 33% of people don't have a supermarket close to them. And if we look at over here, there's a hospital here, there's a hospital here, there's a hospital here, all within the food desert areas that are pink. So that's really interesting also. And you can see down here towards the bottom of the screen, this whole primary area is really lacking access to fresh food, supermarkets. When we talk about food deserts and supermarkets, we're not talking about convenience stores. So keep that in mind. When I was doing my research, I identified that most of these areas have convenience stores, but convenience stores have a very difficult time consistently having fresh, nutrient-dense food because it doesn't move off the shelves as readily available or as readily as the prepackaged, high sodium content, long shelf life type of products. So just keep that in mind when we're looking at these graphs. So then to explore it a little bit further, when we added the green, this is saying 500 people or 33% of the population live about a half a mile or 10 miles from the nearest supermarket. So that is basically the entirety of the Quad Cities. So when I was originally doing this research, I did not anticipate that there would be such significant visuals. I'm definitely a visual person, so seeing the graph really hit home with me. And so I want you to think about, if you're in the United States, to consider using this atlas. It's called the USDA.gov Food Access Research Atlas. And later on, Megan's going to share a handout in the chat feature for you, a PDF handout that you are more than welcome to save and use. And the link to the Food Desert Atlas is on there, and you can play around and see what it looks like for your area. And so, okay, so we live in a food desert. We might not have access to get to the grocery store that's 3 miles away. Maybe we don't have the mobility to walk there. And then how are we going to carry our groceries back? We don't have funding to take the bus, or the bus is non-consistent, or public transportation has been cut due to lack of funding for your city. There's all of these variety of things that can happen. And I'm going to bring it back to Maslow's. And I hesitate with this because I remember back in my bachelor's program, we talked about Maslow's all the time, and I felt like we were beating a dead horse. And I was so tired of everybody bringing it back to Maslow's. And now I am one of the individuals that preaches Maslow's the loudest. I think that we need to be reminded on a daily basis, sometimes on an hourly basis, that it's not about us, but rather we need to assess where our patients are on Maslow's hierarchy of needs. So back when Maslow developed this, he believed that individuals must meet the lower level deficit before they can progress to the higher level growth needs. So if our patient's worried about food or concerned that they might not have food tomorrow, they're not going to be able to work on their inner self, acceptance of their medical diagnosis, and they're not going to be able to make healthier choices, because you can see here that health is a step up from our psychological needs, which is breathing, food, water, shelter, clothing, sleep, all of the basis. So severe food insecurity is one extreme on the scale that we discussed earlier, and moderate food insecurity is also worrisome. So if the people have moderate food insecurity and their access to food is uncertain, they're potentially going to sacrifice other basic needs just to be able to eat. And when they do eat, they're not going to necessarily pick the most nutrient dense food like we talked about. So if you think about, let's say you have a young mom, let's say she comes and oh, can you hear me? Having minor technical
I think we
difficulties.
can hear you.
Can you see me, Megan?
Your screen is frozen, but we can hear you fine.
Oh, I see. It's
Perhaps,
frozen in a very lovely, so I'll just keep going.
yeah.
Make
Or
sure
you
that
turn
you
off your
take
video.
a screenshot of my lovely face looking like that. That will be fun for later. But when you think about if you had a patient, a young mom, let's say you're working in an outpatient clinic and you had a young mom come in with 2 kids. She had to take the bus. She works part-time because she has to take care of her children. The other time, do you think that when you tell her that she has diabetes and she needs to start taking medicine and she needs to go on walks every day and she needs to exercise at least 45 minutes a day, that she's going to hear and retain that and make lifestyle choice changes when she's worried that she won't be able to feed her babies? So when we frame it as such, we really need to get to the bottom of, okay, does our patient have their psychological needs met? And this is where it can get really tricky because these questions are hard to ask and these questions make people feel very vulnerable. And we need to ensure that we're developing a good rapport with these individuals before we dive into these hard questions that make them feel very uncomfortable. So we've talked about foundational information. We've talked about food deserts. We've talked about what food insecurity is, but let's get to the meat of it because we need you to know what to do as a nurse. So how are you going to interact with these individuals? So screening tools is a big thing. Do you screen your patients? You can put your answer in the chat. Um, does your facility allow you to screen your patients? Do you have something built into the electronic medical record that does that for you? Or do you have a paper thing? What does that look like? I see that some people say we don't screen. The admission assessment does, but not included an assessment for that. Screening, social determinant screening is required for all patients. So it's required, but do you do it? That's another question. And what's the compliance with your social determinants of health screening? So there's a lot of options out there for you to screen with. And so I have a couple examples here for you. This is not end all be all, and I know everybody has different electronic medical records. So the first example on the top here is from our good friend Epic, which I know many people use. But this is a cascade type of approach. So if they don't follow and ask the first question, then you're not going to get a deeper dive. So this is the social determinants of health wheel that you can see in Epic for inpatient, outpatient, the whole kit and caboodle. You see it has different components. Food sits up top here, which is highlighted red. So the first question is about financial resource strain. So how hard is it for you to pay for very basic things like food, housing, medical care, and heating? So based on their response, if they answered somewhat hard, hard, or very hard, then the social determinants of health questions should be completed, which are these down below here. So in the last 12 months, have you been worried about food before you get money to buy more, and food you bought that didn't last and you didn't have enough money to get more? So let's say that you work in rural America. Maybe you're working in a small clinic in the middle of Missouri. You have a more antiquated electronic medical record. So this component or these features aren't built into your electronic medical record. I would say that shouldn't be your barrier, right? Our EMR is very task-based. And if you don't have it built in, you can still take the steps to assess your patient appropriately. So down below here, you have 8 questions. This is a screening from the United Nations, and it's called the Food Insecurity Experience Scale. So you could, if you wanted to take the lead, you could in your clinic get this scale, have them fill it out in their, let's say they're coming in for their annual wellness, and you could have them complete the answers here, and then you could show it to the provider. If you're in the inpatient world, same thing applies, right? So if you don't have it built into your electronic medical record, you could, during your admission assessment, say, there's a few extra questions I wanted to ask you, and go into these 8 questions to assess where they're at. So these are a couple tangible things that you can walk away with to help screen your patients. So appropriate communication to providers and referrals for follow-up kind of go hand in hand. It is so important that we're communicating to our providers that our patients don't have food. So I think one thing that it just doesn't, it's not a priority for them because they're thinking about chronic health management. They're thinking about medication management, drug interactions, all these various complex components. They're up at the top of Maslow's trying to get the patient there. But if the patient's sitting at the bottom, we need to make sure that our providers know that they're not there yet. And then referrals for follow-up. So as the nurse, you can really prompt or suggest, what about referrals? So then the provider doesn't necessarily have to oversee all of the components of ensuring that this patient gets help, but rather they can help facilitate, they can put in referrals, and then the referring individuals can help lead and guide and really provide resources for the individual. So what does that look like? I want to suggest to you this, and this seems like kind of a lot initially, but bear with me. I want you to consider this approach: assist, refer, provide, discuss, and schedule. So assist the patient in applying for supplemental nutrition assistance programs. So figuring out what your specific community has available and helping the individual get there. This could also fall under the referral. So if you don't have capacity or you don't feel comfortable with this, you could always refer to the social worker or the community-based organization to help them assist in applying for this. Refer for federal nutrition assistance programs. So SNAP, which we know was formerly called food stamps, WIC, other assistance programs that are available federally. Social workers, registered dietitians, they're going to be your best friends. So develop good rapport with them, because if you call them and say, hey, I really need help, and you have a good working relationship, they're going to hear you and they're going to be there to support you and to support your patients. Refer to an emergency food resource, such as a food bank or a food pantry. So once again, knowing the resources that are in your area. I know my area, we have like a mobile food truck that goes various places. We have various food pantries. Um, and so making sure that they are aware of these resources. Provide a brochure. So I would encourage you that if you really are passionate about this, why don't you take the stance and create the brochure, or work within, if you're in a clinical ladder program, you could have this be one of your projects and really start the initiatives and move the needle. Provide a food box or food bag. So I have to say that I was working, before I worked at Sigma, I was working in a multi-state hospital system, and one small clinic really got it right. And as an educator, I was so proud when I went over to that clinic and they had a cabinet of food, and they had a cabinet of supplies, and let's say baby formula, diapers, baby wipes, canned goods, things of that nature, for patients to take without judgment as they needed, which is amazing. So shout out to that clinic for doing great things and providing a safe space for people to come when they are in need, because as we know, this impacts all other aspects. Discuss with caregiver and family member of the patient. So let's say that you have a 85-year-old patient that's still living at home alone. You screen them using the screening tool that we just discussed, and it came back positive, and they're living at home alone. Let's talk to the family or the caregiver and see how we can assist them. And then, of course, ensure that there's follow-up phone calls or visits made. Just, do these individuals need home health care? Do they need some type of supplemental assistance? So barriers. I mean, we experience barriers every day as nurses. And so one of the most beautiful things, I think, is that we are innovative and we are strong-willed, and we can overcome these barriers. So whatever they look like, we can make our patients a priority. So lack of resources. This could be staff, like you might not have a social worker on staff at your facility, or it could be a lack of knowledge of what is in your area and resources to refer the patient to. So this is where you can really take the initiative to guide that process. No formal screening built in the electronic medical record. As we discussed, this shouldn't, in my opinion, should not be a barrier for you to assess your patients. We can do paper forms. When I first became a nurse, everything was paper, right? Like we'd sign our little name on the medication list. We can have paper forms if the electronic medical record is the barrier. So please don't let that inhibit you from assessing your patients. And lack of confidence. So I think using the assist, refer, provide, discuss, schedule type of approach, and if you use canned text like in the screening tools, you will be set up to succeed, and no concerns about asking these hard questions. Because at the end of the day, we need the patients to know that we care about them, not just their medical diagnosis. And so I know that's a lot, and we could talk all day about all of this content, but I hope you hear me say when I want to empower you to make this better for our patients, to make this a point, to bring it to people's attention, because as the world evolves and things get more difficult, it's going to increase the number of patients we interact with on a daily basis that don't have sustainable food sources for a healthy growth and development and a healthy lifestyle. So I want to check your retention. So we have a brief post-content quiz. So Megan, If you want to launch that for me, please. I think there's 5 questions. Easy peasy. While you're taking that, I'm going to just take a sip of water. There we go. Now they're starting to trickle in. We're at about 60% completion rate, so we'll give you a few more minutes to complete. And also probably you want me to stop yammering on, which is totally fine. Okay, so looking at the results briefly. So what is the World Health Organization definition of being food insecure? Correct. A person is food insecure when they lack regular access to enough safe and nutritious food for normal growth and development and a active, healthy lifestyle. There are different levels of severity related to food insecurity. That is great, and the answer is true. So thank you for 99% of you for getting that answer correct. Food insecurity has been identified as potentially the most impactful. Correct, 100% of you. Thank you for doing that. The COVID-19 pandemic, the negative questions, did not change all forms of malnutrition. So we know that that is false. It did. And then food is located in the psychological needs. So 80% of you got that correct. Thank you for answering all of those. I see that in the chat, people feel empowered, which I love. So if you need any resources or anything, please reach out to me if you need some guidance in that regard. So I want to share with you my references. It's pretty dense, so don't worry about this. But Megan, if you could upload the handout in the chat feature. This is a brief handout, PDF. It talks what the definition is, the moderate and severe food insecure levels. And then of course, it gives you a couple resources like the Food Atlas website and things of that nature. When you registered for this webinar, there was one button, you might have overlooked it or something, and that's totally okay. This webinar is part of my DMP project, and your participation and completion of the survey is optional. So I would love if you would like to complete the survey, but you are not required to complete the survey. And of course, if you have any interest in reaching out to me, you can always email me, linda@sigmanursing.org, or you can reach out to me on LinkedIn. I'm very eager and willing to meet with anyone. So while we have a few minutes, Megan, do we have any questions?
Yes. Could you repeat the I don't know, algorithm abbreviation for assist, refer? What were the steps that you had
Yeah.
previously mentioned?
Yeah, so it's assist. So you want to assist them with getting the right resources. You want to refer, so identifying the right people to refer them to: social work, registered dietitian, community organizations. Thank you, Jessica. Provide, you want to provide them with tangible things to go home with. So whether that's food or a food box or a brochure, discuss. So pulling in their people, like who is important to them. Is it family? Is it friends? Pulling them in and getting them involved. And then schedule. So schedule, make sure you follow up with them and have a follow-up visit or phone call, making sure that they have the right things they need once they are outside of your care. I love all of the comments in the chat. I also appreciate individuals that maybe I went to get my bachelor's with. I see that there are some of those individuals on the call. This is lovely. I really appreciate that. Any other questions, Megan?
Well, we have a comment. I don't know if you want to contribute to this, but your sharing is extremely important as folks who are hungry are not always recognized as being hungry.
Yes, yes. So, you know, taking it back to the personal aspect. So in elementary school, I was seen as the girl that always wanted to go to the nurse's office, when in reality, it was because I was hungry most days, and I just needed somebody to hear me say that. And so our vulnerable populations, their voices go unheard so many times, and that's so unfortunate. If we take a step back and don't think about insurances and all the things that dictate how we care and all the tasks that we're mandated to do in the electronic medical record and all the green check marks we get and the BPAs that come up and all of that sort of stuff, if we just take a step back and actually just look at why we care for patients. We care for patients to make them better, to make sure that they are living the healthiest version of themselves that they can. And we're never going to get there if they don't have food to nourish their body. And so I hear you, and I thank you so much for sharing that. And I hope that, thank you, Megan, for sharing the link in the chat. I really truly hope that this not only inspired you, empowered you to make a change, and then also to, just keep it going. And if this was beneficial, if the people on the call today felt like this really hit the nail on the head, we can also explore what does it look like in other regions. So for my DMP project, my inclusion criteria will be North American content, but I think that there's so much to be said outside of the North American content, right? So what does it truly look like in the Asian space or in the space of Africa? And what nursing interventions can we do in those spaces and places for that patient population? Because we know it looks different. So let's move it forward and let's change it in other spaces and places. So I am going to stop there. As a reminder, though, the survey is optional. You are not required to complete it, but of course, I would love for everyone to do as best as you can if you're interested in completing the survey. It should take no more than 5 to 10 minutes to complete. The survey will also show up in the browser when the webinar ends. So Megan, I'm going to turn it back over to you.
Thank you, Linda. And as everyone's saying in the chat, this has been excellent information, and it's so appreciated for you to share your story and share your research. And I think you've really inspired a lot of people today. So we appreciate you, Linda. So thank you to everyone for joining today, and for Linda for all of this great information. Sigma is grateful that you took the time to share with our audience, and we look forward to hearing more from you in the future. We hope you enjoyed this webinar. As a reminder, 1 week from today, we will email you a link with the instructions for you on how to obtain your Nursing Continuing Professional Development Certificate. Be sure to check out Sigma's upcoming webinars and resources to support you and your colleagues at sigmanursing.org. Also, previously recorded webinars are freely available on the Sigma repository. Thank you for joining us and have a wonderful day. And be sure to check out the survey as we close out of the webinar. Thank you
Thank
so
you,
much.
everyone.